My name is Moana Papa. I'm 42 years old and I reside in the Otara Manukau area in Auckland, but I do come from Te Arawa and from Te Kaha, so Te Whānau Apanui, so yeah, I have ties there and also in Samoa.
Yeah.
To be honest, I think the thing that I'm most proud of is my work with breast cancer and trying to be a good advocate in that, trying to get medicines funded and being part of the Metavivors group and just being at the table, I guess. Also being on the Pharmac Consumer Advisory Committee was something that, you know, you really do have to be at the table to influence decision making, so to be there is good. I'm not on there at the moment at Pharmac, but I've had that experience and know the ins and outs. Yeah. And continuing on with that, now I think it's also very important that Maori and Pasifika voice comes through, because often it's a silent one. A silence sometimes means maybe things are okay, but in actual fact for Maori and Pasifika, it's not. We got the worst outcomes for breast cancer, and we really do need to change that. Part of that is education and being self-educated about what cancer is and what drugs are there to help you, the treatments available, and being a good patient, I guess, and taking your medicine. But also it's very important to have a clear communication with the medical people, your oncologist, breast care nurses, anything to do with the health system. You need to have good communication skills and be able to have that relationship with them, that, you know, if there are any changes in your treatment or your care, that you can articulate that so that they can treat you better and get the right outcomes, which is to live. So I really do believe in quality of life, and also, you know, those pain medicines is really, really important. And also I believe in advocacy, so being there and being a voice. And I wish that more of our Pasifika and our Māori women would step up. I was at the 2009 first Māori Cancer Forum in Rotorua in 2009. It's the first one that was ever held about cancer. And sadly, things don't seem to have changed, you know, 6 years down the track. So hoping that, you know, that this message will get out there and for more Māori and Pasifika to come forward and be part of the discussion so that we can help those with breast cancer and advanced breast cancer. I was first diagnosed about 10 years ago from today, 2015, 10, 11. And that was very harrowing that time. I certainly never thought that, you know, I was diagnosed October last year with bone metastases from my breast cancer. So, you know, 10 years down the track, I like to think that I've gained 10 years, that, you know, I got through that first hurdle, but here we are with, you know, stage 4. And so it is all about quality of life and living a good life while I'm here. And most importantly, trying to get more years here on this blessed earth. So that's what I'm looking forward to, yeah. My experience, well, you know, I had a lot, the symptoms were I had a lot of back pain and just pain in general, just chronic pain. And I was kind of undiagnosed there for about 6 months. I was a bit too quiet with my own GP. Well, I didn't know what it was, but I did say I was always in pain, and sadly that wasn't picked up on. I was given painkillers all the time. But moving forward from that, what I have had since the diagnosis is a hip replacement, which fixed a lot of the back pain that I had. I've still got multiple tumours, you know, bone cancer in multiple places in my body. So only part that's not affected is the head up. After the radiation, I'm on my 4th cycle of capecitabine, which is a chemo drug here. For me, there is no cure. It's just a case of trying to, more years, trying to get more time with my children. And I think that's the toughest thing, thinking that, yeah. When I was first diagnosed, they were 5 and 10, and now they're 15 and going on 20. So they've seen Mum, you know, go through it all and thought it was all over, but, you know, it's come back again. So, yeah, it's hard that thinking about that I might not have a future with them, and seeing those big events and being a grandmother and all of those things. But I'm glad for the time I do have, and that's why we use it wisely. Yeah. I don't know where my future will take me as far as what medications I'll need, but I do know that I may need Kadcyla down the track, and these at the moment aren't funded. And at this moment we're lobbying or talking with Pharmac to see if that can happen, if they can fund it. So these medicines do make a real difference in the lives of people that are stage 4, and even, you know, that 14 months extra with some of these medicines, they can make the difference between a child remembering their mother or father and not remembering them. So I just think that's so important.